Okay, good evening. We welcome Mary Bourke to the podcast, and she is the CEO of Munchee, as well as a chiropractor. So she's going to be talking to us today about all the uses for her fantastic product and explaining how to use it, how to clean it, and why we would use it as therapists in our practice. So welcome, Mary.
Thank you, Stacey. Great to have the opportunity to talk to both you and Terry, but also to your clients. Yeah.
Yeah, fantastic. Well, you could start by telling us a little bit about how the Munchee got started.
Yeah, great. Love to. So the Munchee, Myo Munchee, as we're calling it now, we're trying to call it Munchee for a while, but anyway, it's trademarked as Myo Munchee.
Myo
So
Munchee, got it.
Myo Munchee was originally developed by my dad. It's been around for a very long time. 1966 was the very first patent for the Myo Munchee, original.
Yeah.
We grew up calling it a munchie. So I grew up chewing a munchie very long time ago. And it's been around for a long time. It was developed by a dentist for periodontal condition, so good condition of the gums and the teeth. And that was its original premise. And what he found over many years in dental practice was it actually is a profoundly helpful tool for not just oral health and hygiene benefits, but for growing the face in a really beneficial way, because he got really interested in malocclusions and the teeth, how they weren't aligning and the crowding and how the jaws weren't forming as they used to. That was his big interest in a lot of his work. And he started to use the Myo Munchee with children, and he started to see really amazing change. And so there were studies done at Osaka Dental University that showed that when the child is chewing, the bite starts to change. Now, that was just an observation that started to happen when they were looking at using this device for cleaning the teeth. That's what Osaka Dental University was interested in, the hygiene benefits. So all those little prongs, that's what they're all about on the Munchee. All the
Okay.
little prongs that are there, the reason they were put there was for that massaging of the gums and stimulation of saliva, which helps to clean the teeth. And
Now, was
that's
it original? Oh, I'm sorry, Mary. Was it originally started for children then specifically, or was it for people who couldn't do oral care?
notice for adults. It was
Okay.
originally adults with periodontal condition.
Okay.
And over the years, they got interested in, let's try this with children, and showed fantastic results. And there's all sorts of information on our website about that if people want to have a look. Chewing a Myo Munchee for 3 minutes will do fantastic cleaning of the teeth, but it's the saliva. Saliva is such an important part of things. So that's what it was originally developed for. And then lots of dentists now use it for teeth and straightening. But also what they tested at that same time was the strength of the lips. That muscle around the lips is called the orbicularis oris. And these were studies done 1970s, 1980s, and they showed that every child who chewed a munchie improved the tone and function of the lips. And then what they found from that was, and the teeth start to get in, the jaws start to get into a better relationship when you improve the muscle function. So it's all been an interesting journey, the things you find out along the way. And then I'm a
Yeah.
chiropractor, so I have a very different view of the world. So I picked it up, it's nearly 10 years ago. 9 years ago, Dad died, and I took over the business. And as a chiropractor, I've always been interested in it from the upper cervical spine, jaw stability, cranial function side of things. And then I studied myofunctional therapy and realized, all that swallow, all that nasal breathing, that's all very interrelated with the body posture as well. So all those patients that I was working with, for example, with chronic forward head posture and chronic back in spinal issues, a lot of them were coming from these dysfunctional swallow and breathing patterns. So it's all connected. And the Munchee is a really useful tool in all those different aspects.
So would you say that for most of your clients, do you recommend a Myo Munchee for everyone across the board, especially for people who come in with postural challenges, pain in the back, things like that?
It depends what they're looking for, because why the majority of people who come and see me these days are coming because they know I'm looking at this. So, but I always try and join the dots for people. If they're not ready to hear that this oral dysfunction could be the thing creating, I'll always join the dots for people of the why, because that's the most important thing for me. Why is that dysfunction there? Because as humans, we have the human physiology is incredible. And when it works, it can sort out most things. Like, it really has this fantastic ability to reset, recenter, if everything's working as it should be. But what ends up happening a lot of the time early on, there's something that doesn't get set in the system correctly, and then the body sets up a compensation and adaptation around that. And then you have to come in and start to treat the symptoms that we're looking at. And I know that'd be very much what you're looking at in speech therapy, the work, pathology, the work you're doing, Terry, as well with OT. There's people who are coming where the system hasn't landed in its most balanced form. And then as a chiropractor working with people who come in, they're usually coming with something that's not functioning well. And what happened for me, I guess, when I first graduated over 30 years ago, I was really interested in the cranial temporomandibular joint headache kind of side of things, because that was what my dad had a big interest in at that point, and that's how I was using the Munchee with the adults. And as I went along through my years in practice, I started to realize that all these symptom pictures started early. So I just kind of worked out I had to just try and get ahead. So that's why I'm right down the bottom working with babies now. That's where I spend most of my time.
Okay.
Working in that sphere. I do also work with adults, but working preventatively, trying to get onto it as quickly as we can, because the signs are there before the symptoms start to really get set in, no matter what age they are. And so, because big part of what I was seeing was people who were having treatment for teeth position, so braces, they're having extraction and braces or Invisalign or any treatment to straighten the teeth without looking at why the teeth weren't straight in the first place, there's a high chance that's going to end up causing a problem somewhere else because we, and our bodies are amazing at compensating, but ultimately so sometimes it'll be a person with a low back problem and it's caused by, I'll track it back historically and I'm looking at it going, I think that's all related to the jaw. That's the one bit that got stuck and then everything else had to try and work out how to function around it. And so that's where the Munchee is a super useful tool for all ages, because the action of chewing is one of these amazing movements we were given as human beings that helps that adaptive process. It helps all the other areas, skull, upper cervical spine, and then that's connected to everything else. But chewing keeps it all functioning and moving, keeps all the joints lubricated, keeps us really activating that correct swallow pattern, which helps in so many profound ways. Who knew swallowing? Wow, it's such an important thing.
Right.
You know all about it. It's what you know. You're the expert, and I've been privileged to spend some time with people like yourself to learn about, wow, every time we swallow, where for a lot of people, they're doing these full body swallows. They're having to use all their body just to swallow.
Right, right. And we see that a lot, actually. It's the full body and the compensation and the suctioning here. And you mentioned that you start to work with the baby Munchee a lot. And so maybe you could just give us a few examples of what you see when someone doesn't have decent oral development. I know from my perspective, I'll see obviously challenges with articulation or feeding or swallowing or picky eating. So I'll see those symptoms. As a chiropractor from the body, what do you see when maybe oral development hasn't been addressed properly?
Yeah, so what I'm looking for is trying to get in there and work at the ideal time when those chewing responses really should be starting to activate fully. So that's at around, 5 to 6 months, 4 to 6 months is when you really want to see that system getting ready for the more complex functions of chewing for they're going to start feeding and things down the track. So I'm looking to see and make sure that those jaws are able to, that tongue is starting to isolate out. That's part of what we want to see is the dissociation of these different parts. And that's definitely something that in that first couple of months of life, sometimes when the baby can breastfeed, because they're very short and compressed in the neck and everything is very close together. By 4 months, that starts to lengthen, and you want to see that tongue starts to be able to get some mobility and that they can get some, and that their feeding doesn't start to get affected. And that's definitely one of the things we see that'll be telling us if that baby's not translating to that next age with ease, and they should have all that shoulder stability now, be pushing up on the tummy, and then starting to roll. So they're the sort of things I'll be looking at that'll be telling me whether the oral function's ideal. I'm looking at how's that fitting in with everything else? How's that whole trajectory of growth and development with all the pieces relating to this oral function, which has such a powerful role to play early on. So I'll bring the BB Munchee in as a tool when that baby's got hand to mouth. That's what this, and the hands are in the midline. So the hands come to the midline at about 3 months, and that's what you want to see. And then the consciousness comes in around bringing everything to their mouth. And that's what we want to do. So you put the BB in there and they start to get that experience. And the great thing about that little design of that tool is it's got all those little prongs on it. And it just gives such fantastic sensory input to the mouth and the brain. So all of this information, and the brain is lighting up, and it's just all the information. That's why they're sticking everything in there, because that's where all the information from the brain, so much real estate in the brain is for this lower third of the face. And so they're getting this really fantastic light bulb information going off in the brain. So when the babies put it in, and you would have seen it with the babies you're working with, they look at it, they put it back in, they look at it, and it's just a fantastic experience. And it really is helping to map the mouth, and which is what we need for feeding and speech. We need really well mapped, because it's complex, so complex. How do we not chew our tongue and our lips with those sharp teeth? It has so nuanced, the coordination, doesn't it? Like, just blows my mind, the nuance of those movements. And that's what the baby's doing. The baby, when they have those little teeth and they tap them together, they're working out where those jaws need to land in relationship to each other. And so the BB is a fantastic tool from a sensory, mouthing, and then it's also, when they start to get that activation of the chew, it's a great way to get that bit of chew strength. And for parents who are worried about choking and things like that, great tool to put purees and tastes in. They can get that more complexity that they need, without feeling nervous about any of that. They do need to work out how to manage more complex or solid foods and things. And I'm sure you're all over all of that with your people.
Sure. So in that same vein, can you speak a little bit to the fact that you talk about 4 to 6 months, we should be moving toward chewing, which we talk about a lot. So what's the importance of losing the pacifier prior to that time? What's the importance of that transition?
Yeah, so the pacifier is we call it a sucking tool. So it's a tool to help organize that suck, swallow, breathe synchrony. So when the baby arrives, that's what they need, that functional movement, suck or breathe, suck, swallow, so that they can coordinate all of that. Because once again, that's a hard thing to do, to be able to make sure you're getting because you've got all those tubes here, you've got the food going down one and the air going down the other. So they've got this amazing ability to get that movement happening. And when they're at that age, all those structures in there are much, it functions well. For the first 3 months of life, it's structured in such a way that the baby won't usually get the breast milk down the wrong tube. But once again, as they get to that 4-month age, things start to separate out and isolate out. That sucking movement is no longer the functional movement. That is what the brain is wiring around. Chewing is the next functional movement. And then they have to organize chew, swallow, breathe. If we continue to use the pacifier, it keeps the tongue sitting low and keeps it in that forward, backward motion. And we want the tongue to separate out, and we want it to start resting up to the palate. So by 6 months, we really want that tongue to have separated and start going up, so we can get that lateral growth of the palate. And so the pacifier, we call them dummies in Australia, but the pacifier really will inhibit that next functional movement from occurring, because it puts the tongue in a holding pattern. So does that sort of make sense? Do you want sort of more detail around that, or does that sort of...
I think that sounds great. And I know that Terry, when her therapists talk about it, maybe Terry wants to touch on this just a smidge for our parents, is that how vision plays a role with sucking. and how when we have the pacifier for too long, what that can do to our convergence and our divergence. Want to talk about that a little bit, Tara?
Sure. Sucking is more of this flexion pattern, like you were talking about, front to back. And if we've got kids who are older and now toddling around and up and walking, but they still have this pacifier in, not only now do we have that tongue down, but they're trying to still suck, but now their eyes are up and out and they're trying to walk around and look further out in the environment. And we're kind of differentiating in not an ideal way that link between the visual system and the sucking patterns. So as the OT, I completely agree, of course, with what both of you are saying with that transition from the sucking to the chewing and what that chewing will do and how that can provide a greater stability in shaping the palate, which really is the floor for our ocular motor system and our whole visual system.
Beautiful.
Right. Yeah. Nice link. Yeah. Wonderful. So I have that information is so great and stuff we talk about every day, and we love your product and we use it with, like you said, almost every kid. So we do have a lot of housekeeping questions from our parents, and they sent me a few of them that are a little bit basically about the care of the munchie and the importance of when to use it and how long. So I'll ask you a few of those and you can just tell us all you know. Okay.
Right.
The
Good.
first one being, you mentioned that they can chew on it as little as 3 minutes. So is that the indicated, is that just for babies? Would that be for older? Are there different indications for adults?
Yeah, great. So lots of difference for different ages and what you're trying to achieve. So babies, it's very much short moments of interaction. So little moment, 10 to 20 seconds is great of just for start, just in, out, in, out. And then once they start to get comfortable, then having it in so that so you can see that they're definitely able to breathe through their nose, because that's a great thing about a munchie. It will block the oral cavity so that they can't mouth breathe, which is great. So you'll be able to see very clearly. So babies are very much on their terms and just using it, interacting. By the time they're 18 months to 2 years, you really want to see that they can have it in their mouth and you can, interact with them, get them doing little chomping, sort of probably realistically for that age group, a minute at a time, 2 minutes, like not a huge amount. But when my children were like 2, I would read a story for them. They would have their munchie in, they might chew for a bit, then they might stop, they might chew for a bit. It's just being with them. You have to be with them. You cannot expect a 2-year-old to chew a Myo Munchee on their own and do that. They won't. So
Sure.
that 2 to sort of 4 age group, you really want to spend one-on-one time with them for a couple of minutes, set a timer, celebrate the wins, start small, but build up to about 3 minutes. 3 minutes is a really good time that
Okay.
will, if you did that twice a day with a 2 to 4-year-old, you will get change. You will get change because that's enabling the brain and the nervous system to get a hold of chew, swallow, breathe. It's a functional movement that we want them to have permanently, that they every time they chew, swallow, breathe, that's how they do it. But that 3 minutes in that young age group will give them, but you need it a couple of times a day.
Okay.
A couple of times a day is better than once a day,
Okay.
because that smaller exposures give us better, loading into the brain, for example.
Okay.
Every 3-year-old should be able to chew a munchie for 3 minutes if they can nasal breathe. So it starts to tell us things. If they can't, can they not manage it? Can they not nasal breathe? Is it a behavioral issue? Is it a gag response? What is it that's making them not be able to manage that? But that's what we're working to as a nice standard. 3 minutes of chewing, great. If you're trying to create change, you're probably going to need to do more like 5 minutes a day, twice a day. Like if you're trying to build tone, if you're trying to really strengthen a system that's been weakened, or they're not on the ideal trajectory, then you're going to have to do more to build it up and then to move forward. And so, and then as they get older, you're going to need to do more. So by the time they're sort of 8, 10, you're working towards 10 minutes twice a day. You want that big effortful chewing. And the main thing is making sure lips are together, nasal breathing, and the swallow is occurring with the munchie, and they're not pulling it out to swallow. Because that's telling us that they're wanting to do that tongue thrust and they haven't. Once they can engage, it's such a great tool for helping them learn how to get that back part of the tongue up, because the munchies in there, they can't use some of those dysfunctional patterns they would have traditionally been using. So hopefully that answers.
Yeah. And is there a benefit then to what if you have a kiddo that wants to use it but doesn't necessarily want to chew on it? A benefit to using it passively? Does that also help? Or maybe even adults to help relax
Yeah.
TK and the different malocclusion patterns that we have?
Yeah, absolutely. Passive use is really beneficial because it's the nasal breathing and the swallow and the oral rest posture. The other thing that's really beneficial for passive use is, particularly for adults who've got tight muscles under here from the jaws sitting back, or a lot of tension, it can be a great way to help stretch some of those tissues. If you have it resting in there, it'll start to release some of that. So yeah, lots of patients use it, older patients for temporomandibular joint and relaxing those tissues, but not even for chewing. Yeah.
Okay. One question someone had was that when we often look at kids that have palatal expanders, obviously if you put the munchie in, it's going to interfere with that palatal expander. Is there a problem with trying to use it for chewing when you have the palatal expander in too, or is it just, okay?
It's more just just confirm with your provider, just take it in and show your provider what you're doing if you've got a dental provider. But no, loads of dental providers are using it with expanders. Absolutely.
Okay. And it's a little bit,
use it before and after the expander. You want to make sure that it can be used during as well. Yeah.
right. And a little counterintuitive, but some of our kiddos come to us with braces and then trying to use the Myo Munchee as well. So obviously you're going to put a little more wear and tear on the Myo Munchee, and we're trying to find a rest posture while they're pulling teeth back. That gets a little bit dicier.
Yeah, it definitely can be, and it can be a helpful thing for your myofunctional nasal breathing, correct swallow pattern reinforcement. So it can be a really useful thing, but not so much chewing when they're in those, because it can move the braces as well.
Yeah. Okay. We have a lot of questions about sleeping in it. People want to use it as a nighttime apparatus. Is that something that you usually recommend or don't?
Well, I haven't traditionally, because I'm a chiropractor and not a dentist, and it will move teeth. But my dad definitely did a lot of that.
Oh, okay.
My husband sleeps in one every night. It's one of those things, if a patient wants to, they can. But I don't necessarily recommend it for long periods of time, because it's why they want to. It's looking at why. It can be a really useful tool for keeping that lower jaw propped out of the airway, and for people who want to see if a splint might help them with sleep and things. But I tend to not, for those of us who aren't dental, I tend to probably say, yeah, we're best not to recommend it for long periods of time, because it will start to move some teeth in a good way. It can be a good way. We don't want to do that
We don't want to do that. No.
Intention. Yeah.
Oh. And then how do you recommend cleaning it, Mary?
Yeah. So like a toothbrush, rinse under water. So it's just saliva. So that's great. But make sure it gets plenty of air around it. So leave it out so it gets some air. And you can boil it up. It's medical grade silicone. It will be absolutely fine. So boil it if you want to, if you like, get it nice and hygienic. But do that once a week. Bicarb soda or any of those dental denture kind of tablets you can use. Any of those kind of things can work for, especially if you haven't used it for a while and you want to get back into action with it. But I tend to just have mine, because I'm using it a lot. It'll just be sitting on a little plate in the kitchen, because I use it when I cook.
Perfect. Perfect.
Yeah. So just rinse it under the tap. Yeah.
Yeah. Yeah. That's how I use mine too.
Yeah.
Wonderful. I had one more question and now, okay. Here's what it was. So occasionally we've had kiddos complain about the prongs, like feeling it rub a little bit, like on their palate. Is that something where you shave it down, or are you looking more at, why is it rubbing there? It shouldn't be rubbing there. We need to look more at, expand.
Yeah. If it is rubbing, but we're not all exactly the same, and majority of us do have some deficiencies in the way our jaws are formed. So trimming it can be a good solution for, give it a week or so, because when we first start chewing it, there can be an area like new shoes. Sometimes, you wear them in, you take a bit of time, And,
Sure.
they might rub a little bit and you might pop a Band-Aid on, then you'll be okay. But it's a little bit similar. It might be a little bit sensitive to start, but then it should be fine. And if it's not, then it's always causing an irritation, you can trim. Just trim small amounts off. Don't trim very much off because you don't want, what is it? What's the saying? I'm trying to think what the saying is. Anyway, just tiny amounts because you don't want to hack into it and then go, oh, oops,
Yeah.
Mhm.
And how long should one last reasonably if they use it daily and don't have to modify it too much?
I've had munchies for years.
Yeah.
I've not ever bitten through one. I've not ever had one break down, and I've got a lot of them hanging around. So they can last for years. If a bite is out of balance and there's some heavy forces,
Sure.
similar to shoes, some kids go through shoes
Sure.
really heavy on them. And so the munchies are the same. So we say 6 months, we'll guarantee it for 6 months, but it needs to be with parental supervision, nasal breathing, and understanding for certain bites or certain neuro conditions and things, they may need to replace it, keep replacing it. And not to say that it's the fault of the tool, it's not. It's still a useful tool. And we have patients that Dad was working with, and they order a bunch of, like, there's 2 people in the world that have this serious condition, and they use like 6 a month or something. They just have these conditions that they really have heavy chew patterns, but the munchie is the only thing that can help them function. So it's interesting. It's not to say that it's not the right device. It's just looking at who's using it and setting realistic expectations for the parent. But when we had our test done for all our biocompatibility and our functional chewing, there was no breakdown in the product at all. There was no breakdown.
Yeah.
So
I've had mine for years too. So same one.
So it's really looking at who's chewing it and the bite forces and the balance. But just knowing for the parent that, if just being ahead of that to say and also the first one might break down, but once they've improved the balance of forces,
Sure.
the next one should last longer. Or it's just like they have to just be really, really right on the child and watching, making sure they're doing it with lips together, because it makes a huge difference. If your mouth's open, you can get a lot more force behind it.
Yeah. Okay. Good. Is there anything else you can think of, Mary, that I didn't ask that you would want parents to know about it?
No, not really, but only that just chewing is one of the most profoundly beneficial movements. And the more I go along, the more this is just my mission in the world now, is to try and really get chewing to the table, because it's not optional. You have to do it. And we've kind of almost outsourced it with the little amount of chewing we're having in our processed food and diet. So I just really want to reinforce that for you, as therapists, for you guys, the people you're working with. Profound changes happen when you get functional chewing working. Nasal breathing, correct swallow.
Yeah,
Gifts.
absolutely. Well, we couldn't agree more, Mary. We really
Correct.
appreciate your time today, and I'm sure our parents are going to love the information, and thank you so much.
Thank you.
Such a pleasure. Great to
All
speak.
right. We'll talk to you soon, Mary. Thank you.
Bye-bye.
Bye.